The yellow on the study is representing people who have disabilities, and you can see that people with disabilities had rated the importance of having health care available in all its facets, whatever that person described it as being even more important to them than the general population, or who was in the other study. And then the other piece, if we look at it, was the adequacy of the services that they could get. And here we are in Washtenaw County, in this mecca of wealth of health care, and yet we have inadequate health care being seen by people who have disabilities. And the biggest piece that we saw that was connected to that was transportation, was the translation of the care that they were getting into terms that they could use and that they could take out with them and put to use. And so even though we have this mecca, we have to figure out how to make it so that we reach the population who is needing and wanting those services. Just like we were hearing yesterday, I am certain that if we did a Google map of Washtenaw County, we could not go for very many miles before we saw another health care provider. But if we put the overlay of where all transportation in the county was accessible for those persons to get care, it would not be matching up with every one of those sites. And that's not because we don't have good transportation and not because we don't have good health care. We just have to figure out more ways of making stronger connections, as just one example. I also put in here a graph here that is, and on mine, is it showing up on yours? Because mine is barely showing the disability community, so I'll try to look to the side for this one. What's important is that this came from a study that was done, and I actually have a bigger copy for myself, so let me just open it so I can see it better. Sorry about that. This was Healthy People 2010 that put this out. And this data is from when they were beginning to collect data in 2000 and looking at what was out there. So this is all the way back to 1997 and 98 from different studies that were done by people who received dollars from the CDC, from National Institute of Sciences, I'm forgetting one of them. But this will be available online after all of the presentations, and so you can look more closely at it. You can also go to Healthy People 2010. But what you see is that people who, I'm going to start at the opposite end, people who were children who reported being sad or unhappy or depressed who had disabilities is far greater than people who did not have disabilities. For people who were adults who were feeling who reported having feelings of their depression or sadness interfering with their, I cut it off here on the slide, with social interaction and being with others. Again, the disability community's rating was far beyond the general public. For people who are adults who want to participate in social activities, who just have that desire to be out in public and be a factor, the disability community was less than people who did not have disabilities. And then this other result here that we're looking at is adults who felt they had sufficient emotional support. Again, that's having somebody who, when you need them, is there to listen, is there to help when you can't quite do what you need to do, is there to make sure that you are getting to whatever appointment you're doing or getting you out in that social environment, or just to be there to sit next to you just because you need a calming influence in your life. And you can see that, again, people with disabilities report having less support than people who don't. And then finally, this other last one is adults that are reporting that they have satisfaction with their life. And this one really is one that hits me hard because this is something that I can't say is true for me personally. As you can hear, as I talk to you about this and you hear my passion in my voice, that passion really comes out everywhere in everything I do. And somehow that was instilled in me even before I had any of the disabilities. And so in that way, I guess I was very fortunate that my disabilities came later in life because I learned to find my other skills that were there, and then I'm able, because of who I am and how strong I am, to put those into effects now. There are still times when you say, oh, wow, that wasn't great, that didn't really suit me. But I cannot tell you that I am not satisfied with my life. I can tell you that because of my motivation and skills, I'm always reaching for more. And if you look at some of the community programs that I happen to participate in, it's not because I'm trying to be superhero of the people in the disability community. That's just who I am. And those who don't do that, who want to get their message out, still can. And so we try to work at giving people their voice, and that's something else that all of us who get involved in research projects are able to do. And so this is just to look at this comparison study. I also might add that just the secondary piece of the Project Healthy People is this thick. And so there's lots of other comparisons that you can look at besides mental health. But if I was to print out the whole project, it would be like, a huge weight to carry in. But I just wanted to at least hold that up for you to see that secondary conditions with disabilities did take at least a major role in that particular study. What I'd like to be able to show you is that there would be more data to share. It's really hard to find data that is significantly connected to people with disabilities, where it's talking about how people with disabilities are functioning, how they are able to be part of the community and participate. How are they able to manage their particular condition? And we do talk about, and we do have connections with people from all different communities. Even this morning at breakfast, I was sitting with somebody from Flint, and we were talking about what's going on there. And we were sitting with somebody who's from the Kidney Foundation, who happened to also be from the School of Social Work. Yesterday, I talked to a woman who was from China, who's a pulmonologist. And so we're talking about how does all of this affect people's functioning, and what else can we do about that? And so we need to figure out on getting that data in, really qualifying disability as one of those ethnic minorities that we choose to put there. And truly we could say it's not an ethnic minority by itself, but it is an impactful minority that we need to say. So if we add that to the list, I would say you would see much more data coming out in that area. Sharing our visions. If we take a look, I know that Carolyn had put a slide up previously, which I didn't know she was going to do. If I do, I would have maybe not done this one. But this is just to compare a little bit about what's happened with U of M. And I put U of M Hospital because that date predates original research that was done at the University on healthcare. And then what happens with the Ann Arbor Center for Independent Living. So you see that we both were established some time ago. Obviously, the hospital was established far before us. We were actually the 4th Center for Independent Living in the country, and the first in Michigan. There are now 15 in Michigan and more than 600 nationwide. So there's a lot of resources that we can all tap into. We have peripheral connections to every single one of those institutions. So when I need something in Michigan and it's up in Flint, I go to the Disability Network that is in Flint. When I need something that's near Detroit, since that's one of our other partner communities, I go to Disability Network Wayne County. When I need something in Washtenaw County, Livingston County, Monroe County, that comes out of my office. And so we have fingers that reach different parts of the community, and we're able to help look and be part of what that means. We assist people with disabilities, that's what PWDs are, to achieve their social participation, to be involved. That's part of what this innovative research, when we help people find that impactful result, they will be able to be more connected. The university has MICHR. We are involved with MICHR. We're on the, I forget the name of it, Community Coordinated Engagement Community Council. Is that right? Community Engagement Coordinating Council. One of those C's goes someplace. And we are looking at how to access the same opportunities that TABs do. Anybody know what a TAB is? A TAB is sort of that slur word or acronym that a lot of people in the disability community use. And TABs are temporarily able-bodied, which means that's everybody else who doesn't have a disability. We want access to the exact same things that everybody else has. We do a lot of peer advocacy and support. I was in Israel last November, and I was meeting with their joint distribution of for communities, and they said to me, well, what do you do for peer advocacy? We need to build that here. It's not a strength right now in their disability community. People get injured or have diagnoses, and they're sort of still in their own little vacuum, is what they were telling me in Jerusalem. And so we are looking at how do we share this further than our community, and how do we make this a bigger part? Peer advocacy is one of the mantras of Centers for Independent Living, and I think that we've heard already that that's part of some of the community research projects that we have been approving, that people are looking at. We were hearing about one just earlier in some of the other presentations.